Did you know untreated injuries can lead to chronic pain with the potential for back surgery? Up to 50% of back surgeries in the United States are considered unsuccessful.
That's crazy.
Agreed.
Hey guys, welcome back. We are here at GlowTalks Studio talking something near and dear to my heart, sciatic pain, back pain. I know a lot of people suffer from this. I did for years and it was just so challenging. So I thought, hey, let's demystify this and talk about how we can help ourselves with sciatica. I've got Dr. Jenny Hagemeier here from Palmercare Chiropractic. Thank you so much for being here.
Thank you so much for having me.
I'm really excited to have this conversation because, like we discussed just prior to coming on, that I really suffered so bad. And I felt like I did everything to help myself through the pain of sciatica. So I know a lot of people suffer from pain in general, but this lower back pain and this like very specific type of pain is something that I think, you know, we need to share. We need to share and help other people to, you know, heal themselves through this process.
Absolutely. I agree. And
Yeah.
Sciatica is something that a lot of people have. As you were saying, I think about 60 to 80% of people, either of adults, either have back pain or will have low back pain at some point in their life.
Yeah.
Which is much too high.
No, it is. And I always saw a chiropractor. I think my first session, I was maybe 18 or 19 after I got my first full-time job and had insurance. And I swear, the first adjustment, I walked out and my vision literally was better. One adjustment.
I absolutely believe that. I mean, keep in mind, the nerves in your spine, you have your brain sitting on top, your spinal cord coming down and all of the nerves coming off of it. Then all of the nerves in your body have to go through your neck in order to get to the rest of your body. So neck adjustments especially are just really important and can be so helpful for so many people. In fact, the very first adjustment, the very first chiropractic adjustment was actually to try and to fix hearing loss.
Okay, so that's kind of where it all started. Wow. Yeah, and I mean, I wouldn't recommend you guys to try to crack your own necks at home, but I can get pretty good with my foam roller at this point. But like the hips and the neck, those are areas where you may want to have a professional, you know, to do an adjustment.
Absolutely. And you were talking about your sciatic pain. I would also say that a lot of sciatic pain or pain from the low back and going down the leg, that can be coming from a couple of different areas. So having somebody diagnose exactly where your particular area is and what to do about it would be really helpful. Yeah,
I absolutely agree. And to be honest with you, just because I had worked in integrative health and we had chiropractors, we had acupuncturists, which I know you mentioned in your office, you also offer acupuncture.
Yes, we do.
But I noticed that, you know, not a lot of people were really read up on looking at diagnosing the pain maybe from different layers, right? Diagnosing and then also like treating the pain. Because I dealt in nutrition and I know over the years, what I realized was the foods I was eating would flare it. It would flare up at times that I would eat what we call nightshade veggies, which are like bell peppers, tomatoes, eggplant, jalapeños. And believe it or not, I used to have a really lovely Jalapeño Margarita. And then like 2 days later, I'd be like, oh my gosh, what's going on? And I knew in my case, because I also had a lot of other food sensitivities, that it was really like my large intestine pushing on the nerve in the hip. Or, I mean, it could be other things. We were talking about even uterus or sexual organs, that they can become inflamed and then they are pushing from the inside.
Yeah, that is part of it. So the nerves in your low back are not just going down your legs, but they're also going to your digestive system and your reproductive system. So making sure that those are getting their signal out properly is very important for the health of, well, your entire body. But another thing that we don't talk about enough is how nutrition and inflammation can play a part, not just inflammation within your gut or within your reproductive system, but that kind of inflammation gets out as well and can cause chronic inflammation within your body, which can absolutely contribute to pain.
I mean, I feel like I see you brought a spine for us to look at. So I do want you to show us a little bit the anatomy and kind of how it all works. But I did notice that also if I'm eating foods that are causing inflammation more throughout my body, the vagus nerve, which is kind of behind the heart area and this part of the spine, I feel like that gets inflamed. Like I feel that all of this just tightens up and then I literally can't move.
There's something called leaky gut.
Yes.
We don't, which as a nutritionist, I'm sure you know, the junctions of your gut can become looser over time and things can slip through those junctions.
Right.
And that can cause more inflammation within your body in general.
Like systemic.
Exactly. Systemic inflammation, which can make all pain worse. And chronic inflammation is something that a lot of people are dealing with.
That can damage your endocrine system too, like in a major way. So I dealt with a lot of that, not knowing that I had leaky gut and not knowing that I had candida for years living in my gut.
Yes.
And it was really deteriorating all the tissue and the lining of the intestines, which are meant to keep the gross stuff inside and the toxin inside. So sorry, I know this might be too TMI, but like this is like the reality of our bodies, right? So
well, and you and I were talking a little bit before we started about the gut-brain axis, and that we bringing that into what you were saying about the vagus nerve. Your gut and your brain are actually very closely related. Your gut actually has its own entire nervous system within it. Wow. And so making sure that you have proper gut health helps not just your gut, but your entire body. Yeah. It affects your brain in ways that we're still just barely scratching the surface of. I don't know if you knew this when you were a nutritionist, but I've always been fascinated by the statistic that I believe you can tell that someone is trending towards Parkinson's disease 7 years before they get it by looking at their gut microbiome.
Yep. Well, I noticed as well when I had the leaky gut and I lost my gallbladder, first of all. I had to have emergency surgery. It was totally distended. My whole body was basically septic. Like I almost died, which is crazy. It's so crazy. And I had no idea, like at that time, what was going on. And it was too late. Like there was nothing I was going to be able to do to save it or save myself, right? So, you know, this stuff can really like multiply, but we have to, I always like the concept of, you know, at first your body will whisper things to you. And this is that whole brain, gut, and the whole axis in your nervous system. But we have to kind of be trained of what to look for and what to listen for, because it's going to stop whispering at a certain time and it's going to start feeling like a hammer's pounding on you, you know, which is the sciatica or extreme pain over time.
Yes. Pain is, we often say that pain is actually the last thing to show up. Your body compensates and adapts for as long as it can. You end up with other symptoms sometimes, such as gut issues or headaches.
Anxiety, mood swings. Like that was the other thing that I was like, whoa, I did not realize how much my gut health was affecting my mental health.
It absolutely does.
And we're talking, we have a mental health crisis in this country.
We do.
And a lot of it is stemming, I think, from just a brain-body disconnect, systemic inflammation, the gut being in distress, you know, and then of course, yes, we all have busy lifestyles, and you know, even my kids eat McDonald's or eat Chick-fil-A sometimes, but like when you do it constantly every day and you're not paying attention and you're not detoxing and you're not making good choices with your food, like it will show up in your mental health.
It will. So we also have something that we call the Triad of Health. You can think of health as being structural, chemical, and emotional. All three of those factors contribute to your holistic health. And if you're not paying attention to all of them, then they will catch up to you and you will start to notice.
Yeah. Wow. It's just so fascinating. I can talk the subject all day long. So what I want to do, though, is take a look at your spine. I was so happy to see that you brought this. So
I'm always so happy to talk about it. So yes, for those who are listening, I have a plastic, I promise it's plastic, spine with me. So if we want to talk about sciatica a little bit, well, we can talk first about the fact that your spine should be a straight line up and down when I'm looking at it from the front. When we start to get curves, that's what we call scoliosis.
Right. When
we're looking at your spine from the side, there should actually be some nice curves in it. We want a nice curve in the neck and a nice curve in the low back because those help to take pressure off of your spine.
Okay.
So straightening of the spine in this direction can put more pressure on the discs that are in between the bones and can put more pressure on the nerves that are coming out the back.
So the yellow are the nerves?
Yes.
Is that right? Okay.
Yes, the yellow ones coming out here are the nerves.
Okay.
But in the same vein, too much of a curve can also be a problem. I know that you were telling me that when you were dancing, you are put in very extreme positions for your back.
Yeah.
A lot of extension will close down these holes that are coming out of the back of the spine.
I see.
This hole is where that nerve is coming out, and the smaller that hole gets with those extreme positions.
Oh, like when I'm
when there's a lot of an arch
forward
in the back.
Okay.
Yes.
Got it.
When the hips are rolling forward and the spine is arching back, that puts a lot of stress on that hole where that nerve is coming out, where it's not just a nerve, right? There's also blood vessels coming out of there. And
fluid, spinal fluid.
Spinal fluid, it stays within the spine.
Okay, up and down.
But that also has to move up and down the spine.
Yeah.
So those kinds of extreme positions that you were talking about, those put a lot of pressure on those nerves as they come out from your spine. And the sciatic nerve specifically is coming from your L4 down to your S, that's your sacrum, your S3. And so those nerves come out, branch out, kind of like the roots of a tree, come back together to form the trunk, and then branch out again as they go down your leg.
Down the leg. Okay.
Yes.
If I had a prior injury, let's say I fell once when I was 15 on my way into a indoor soccer game, and I hit my tailbone like 3 times.
Okay.
And it was really extremely painful. Like it took weeks for that to feel better. But I was always curious, maybe if I had a fall or something happened, would that cause later on something like sciatica?
That absolutely could contribute to it, because I used to ask in school, sometimes I would be looking at something and think, is that really related to this thing over here? And my answer would always be, everything matters all the time. That's what I say to my patients sometimes. That's what I say to myself. So things like that can build up over time. Either things that we're doing constantly in our everyday life. For example, if I'm sitting cross-legged and I always cross my right leg over the left, that's the kind of thing that will cause a compensation in your body. But also things like injuries that aren't taken care of. Your body probably compensated for that and adapted, but that didn't fix. It compensated and adapted, but it didn't fix or go back to where it was supposed to be. And that is something that could then remain unchanged, and you might not have pain
of like
yet.
Tissue that my body used to heal the area, and perhaps it became more calcified or blocking something.
Or your pelvis could have that. For the example that you're talking about, falling on your tailbone, that could have shifted your sacrum in a way that when it tilts, that can tilt the rest of the spine. And your body might have been slight enough that your body could compensate for it, especially being 15. Kids are much more able to compensate.
Right.
But your body will eventually have all of the added stresses of everyday life, of the activities that you're doing, the ballroom dancing, the toxins that are in your system, all of
food
those
sensitivities,
exactly,
systemic inflammation,
like environmental factors, mental health factors, all the chronic stress that we have these days.
Yeah, I want to talk about that because, like I shared just before we started, and I know I've said this to a couple of folks that, like, over time, just about my experience, even with the stress of losing my husband, unfortunately, I experienced the worst of my sciatic pain the 2 years leading up to his passing. And the day after he passed, I remember waking up that morning and getting out of bed and being like, my sciatica is literally gone. Literally gone. And I was just like, this isn't even real. Like, what is happening right now?
A lot of people, when dealing with stress, there are 2 options. Either they will be more in pain while they are in stress, and when that stressor is gone, the pain can reduce or go away entirely. The other option is, for a lot of people, they will continue to be stressed and not be in pain until they are finally able to relax. And then the adrenaline and the cortisol go away, and then everything that was hiding under the surface pops up.
Okay. So it is true. Like, our pain and what we're experiencing in our body can very much be tied to our emotional distress and health.
Absolutely so, yes.
You guys heard it. So, oh my gosh. Well, this is really, I'm so fascinated. So let's keep going. Let's talk about maybe even like the upper back. Like, I know sciatica stems from here, but like, are there other things that can happen that would show pain in your body? And where's the vagus nerve, by the way? Like,
the vagus nerve starts coming up and out of your neck and then goes down all the way down. And you can think of the vagus nerve or being you have two parts of your nervous system, your fight or flight and your rest or digest. So you can think of your vagus nerve as being part of your rest and digest system. And when it's not working properly, then you sometimes do not rest or digest as easily or as well as you should.
So constipation, irritable bowel syndrome?
Those can absolutely be related to the vagus nerve, can be related to that stress that we were talking about as well.
Wow. Yeah. Because I feel like when I get like a couple, like when I go on vacation, for instance, and I'm like, okay, I'm going to eat a little bit of this that I know I'm sensitive to. I'll eat a little bit of that. And at this point, like, I feel like I have a good enough handle that I don't ever overindulge in those items. But after consistently doing it for 7 days, like, I usually know that the next week I'll be experiencing some kind of pain or, backlash from the things that I've eaten. And I feel it, like, and especially now that, I'm dancing and have more routines and more like extreme performing. When I get that, I feel so stiff. Like, I just can't perform the same way at all.
Inflammation contribute to that stiffness that you're talking about. Another thing that happens is the muscles in our body tense up around areas of dysfunction.
Okay.
So anywhere that you have dysfunction in your body, that's why a lot of people have that neck tension these days.
Right.
Because a lot of us have...
I'm like thinking about it now.
A lot of us have a lot of dysfunction within our neck because of the way that the world is these days with cell phones and looking down. A lot of people who work at computers and all of the things that we do where our necks are constantly coming free.
Yes. Okay. Yes. So what kind of things can we do to like help ourselves? I mean, it's hard, right? To be like, oh, I have to think about my neck and like, let me not look at my computer like this.
One of the best things that I can say in general is just movement. Movement is life. Motion is lotion, as some of my professors have said.
I love that. Yep.
Yes. And it is very true. I don't know if there's one particular posture that I can give to anybody. I think I've also heard people say that the best posture is always the next one because you should always be moving
into a new one.
Yes.
That is... I'm like, literally, my brain is going wild right now with this whole dancing thing. Like, I did find that it has helped me tremendously. My health, my mental health, also connecting with others. So my emotional health. And then, like you said, motion is lotion. Like, it does keep me up and going and excited in general. I mean, not that everyone wants to do competitive ballroom, but like, there is a social aspect to it and that you could just go for fun.
Yes. And you're right. There's not one particular motion that is best for everyone, but finding some kind of motion that you enjoy particularly and that will keep you moving, that's incredibly valuable.
I did find with sciatica, I could do slow yoga, like yin yoga, where it was more gentle and stretching and holding poses in a gentle way. Walking, I felt like as soon as I would get up and like get moving and walking, it did help.
Yes.
I mean, chiropractic care, I definitely found relief from that. It wasn't necessarily that I was like, oh, it's all better and it went away. But I paired that along with the acupuncture, like you also offer in your office, and with already looking at my food intake and really trying to hone in of, not eating stuff that I knew was going to trigger it.
Yes.
But yeah, I guess lo and behold, moving around, having some activity every day, finding joyful practices like that in movement.
Very much so. Along with joyful practices, we can also talk about the fact that our thoughts have power. The things that we focus on in our everyday life can make a huge difference to our pain as well. Making sure that we have some kind of either gratitude practice or finding things to be thankful for throughout our day, journaling, something that helps with our mental health as well, that makes a huge difference.
Yeah, no, that's great. Like, actually, one thing I did with a coach was every morning I would write down like 3 of my goals. And then every night I would go back into the document and write whether or not I accomplished them or what I felt about each of the goals and what happened. And I did that for 30 days. And it actually like got me into a rhythm of just now it was kind of like the back of my hand to do that. Or I would set an appointment in my calendar every morning, just a 5-minute appointment, just as a reminder to even put on YouTube like a free meditation or breathing or, affirmation exercise. 5 minutes.
Yes.
That's it. And I would literally just try to be in a safe, quiet space and just do the 5 minutes.
You're right. Even 5 minutes makes a huge difference. And making sure that we do it, if we're consistent with it for one day at a time at first, that turns into a week, that turns into a month. And that is the kind of way that you build consistency and
resilience.
Yes. And routines that are lasting.
Yep. Mental fortitude. I think that really is helpful. And yeah, just start small. All it takes is like one step, and then you can do the next step and the next day, and it doesn't seem so overwhelming.
Yes.
So I love that you really have this holistic approach to the body, pain, also adding in these other practices that ultimately, you know, we hear it, we see it, all the recommendations, but for real, like if we live it, it will help our quality of life.
Yes, it absolutely does. And that's what we're trying to go for, right? We want quality of life. My grandfather last year turned 100 and got to have all of his family around for his birthday.
That is incredible.
And that's what we really want. Is he was dancing in his wheelchair for 2 hours on his 100th birthday.
I'm getting chills.
And that's what I want for everybody is a quality of life where you can be dancing when you turn 100.
Yeah. Yeah. That's what I imagine for myself, as a matter of fact. And I love ballroom actually, because a lot of the time we'll go to the comps and, you know, we're paired up with our pro partners at our age level. You know, I mean, it's kind of a wide range for the age level, your dance level. And then you see people in all different ages, size, shapes, and older folks there. And I'm always just like, I want to be that when I'm 80. I mean, I talked to this one lady, when we were doing hair and makeup in the morning at the crack of dawn, and she was like, yeah, I only started learning ballroom maybe 10 years ago. And I think she said she had just turned 80 and she had 2 knee replacements within that time. And she's like, I can actually dance even with the knee replacements. It's better for me. It's harder for me to go down the stairs. It's more painful to go down the stairs than it is to come and do like a full day competition of dance. And I was like, okay, well, hey, I mean, it goes to show, you know, don't ever give up on yourself and definitely look for fun things to do to get your body moving. Yes. That's going to be really the best for spinal health, right?
Yes.
Over time.
Movement in general is especially important for spinal health because of those discs that we briefly mentioned. Your discs only have so much vascularization, meaning they have a minimal number of blood vessels that go into them. So the main way that they get their nutrition is from movement.
Okay.
Making sure that you're hydrated and from movement.
Okay. Wow. Yeah. So all of this stuff matters. I love it. Share with us, for instance, I mean, I've been to a chiropractor so many times, and I know a lot of them have different ways of like making diagnostics and all of that. Like, how do you approach, let's say, a new patient coming into your practice?
So when you first come into the office, I'll first discuss with you what kind of symptoms you're having and any history that way I know what you've been dealing with, because your symptoms specifically help tell me how to treat you. I'll also talk about your goals, because if you want to be ballroom dancing until you're 80, that's what we want to focus on. And then after that, we'll do a head to toe exam of your nervous system. I want to look at how your reflexes are firing, how your muscles are working, because while I'm sure that you are strong, if one muscle is weaker than another, I put that in quotes because what we're really looking at is how your nervous system is getting to that muscle. You can think of your nerves as being on a dimmer switch. We want them turned all the way up all the time so that you are functioning at 100%. If your nervous system is functioning on that dimmer switch, your muscles might be a little bit weaker.
Yeah, I felt weakness when I had the sciatica for so long. I just felt like by the end that I just was not strong.
Absolutely. And that can very much be that there's something going on between where your nerve is coming out of your spinal cord and where it is reaching that muscle, that we need to deal with something in that. So we'll look at your nervous system head to toe. We'll look at your range of motion to make sure that you are moving properly, because motion is life. And that will also tell me where some dysfunction can occur, because those muscles can tighten up around those areas of dysfunction. And we will, if I feel the need, we would take x-rays as well so that we can really see what's going on with your spine. Okay.
Wow. That's great. So it's very thorough.
We try to be, because your health matters.
Yeah.
Everything matters.
And I know also, like, once we did the initial consultation, I typically, especially if I was feeling pain or what I realized was going maybe for the first few weeks, going a couple times a week.
Yes.
Was very helpful, because your body just essentially wants to kind of go back to what it was?
Yes, exactly.
Okay.
We talk about muscle memory all of the time, but we're usually talking about it for things like dance or for driving in the car. But your body has muscle memory for where your body is as well. And so a lot of times chiropractors, we generally recommend more adjustments at first because an adjustment might only last 24 to 48 hours at first because your body wants to come back to what's familiar.
Yeah. I also remember, and this is just popping into my mind, when I was pregnant with one of my pregnancies. Oh man, the one day I tried to like get my kid out of the bathtub and my back got stuck.
Oh,
I literally had to sit down and be like, what's gonna happen? Like, I didn't even know what to do. So do you treat or see prenatal patients as well?
We absolutely do. Webster technique is something you can specifically ask chiropractors if they are trained in that. It is a specific pregnancy-related technique,
Okay.
which I am trained in. We also see, a lot of people also don't know that chiropractors can see kids as well. I personally started going to a chiropractor when I was 3 years old.
Okay.
And there are techniques for that too.
Okay. Wow. Yeah. So it really is so holistic. And I know there's a stigma and people think like it's not safe, or I've heard some stories, but I never experienced anything but really good results from using chiropractic care as part of my, layering of health and wellness. So
I'm so glad. I will say, like any profession, you can find people who are better at it and people who are not. But I will also say a lot of the things that people are worried about, there are statistics that you are more likely to get struck by lightning than to be injured from a chiropractic.
Okay. Well, there you go, guys. Do not be afraid. If you've already been struck by lightning, then you have no chance of having anything bad. I know someone who got struck by lightning through a window. It's crazy. I know. It's crazy.
Through a window?
Yeah. Yep. Through a window. Fascinating story. He's alive. He's great. I think maybe it made him like a mega ultra man or something. I don't know.
I'm sure it encouraged him to live life to the fullest.
Yes, that is for sure. So, well, thank you so much for being here. I am just thrilled that we could help, our viewers learn and understand a little bit more about their spine, pain, some tips and things that they could use to help themselves. And of course, seek chiropractic care as one of your options.
Absolutely. And to reiterate to people so that they don't feel overwhelmed, I would always say if you're dealing with pain or any kind of health issue, always go back to the basics first. Naturopathic doctors, and you've probably heard this as a nutritionist, they have something called the fundamentals of health. You always start with the basics in terms of things like making sure you're getting enough hydration, making sure you're eating properly,
Sleep.
getting enough sleep, because that is when your body heals.
Yeah.
If you come to me and tell me you're only getting 5 hours of sleep a night, I'm going to tell you that it's going to take you much longer to get out of pain. So making sure that you focus on the basics like that will always be the best first step to health that anybody can take.
Great. Yes, those are all like really amazing. Of course, like we've talked about this on other episodes and in regards to other things, but yeah, you guys are really hearing it like in not just once. So, well, thank you again, Dr. Jenny. I am really just so thrilled that we could share this information with my viewers. Let us know, where can they find you online?
You can find the company that I work for, Palmercare Chiropractic. You can look that up online and see any of our 24 locations. We have some locations a lot in Northern Virginia, some in, I think, Georgia and Florida and Texas as well.
Okay. And you're in Centerville?
Yes, I am at the Centerville, Virginia location.
Okay, wonderful. And they have a website?
PalmercareChiropractic.com, yes.
Okay, and you guys can find all those links below, so don't be shy. So anyhow, well, let's get to the ping pong questions.
Absolutely.
It's a little game and just no pressure. Short answers are fine, just so our viewers can learn a little bit more about you before you leave us today.
Absolutely.
All right, so coffee or matcha to start a busy clinic day?
Neither. Bone broth protein powder.
Okay. I recently started doing some bone broth like in the morning, and it's so satisfying.
It is. It curbs any hunger and makes me feel full for the day and like I've got enough energy.
Yeah, that's so great. Okay, I love that you said that because I'm totally on the bone broth right now. What is one wellness trend you wish would just disappear?
Diet trends in general. I think that any of them could be good for a time, but no diet is forever except
It's not
for
sustainable.
trying to eat whole foods as much as possible.
Yep. Okay. Yep. I'm totally with that. Same with you. What's your personal favorite way to move your body when you're stressed?
Actually, as a dancer for 8 years, I love to dance in my
Okay.
living room.
Hey, who would have known? That's so great. Well, now you can send this to all your patients.
Absolutely.
If you weren't a doctor, what career would you have pursued?
Before I really started to like science, I loved reading. I still love reading, so I think I would say book editor.
Okay, love that. Are you a morning bird or a night owl?
I am such a night owl, but I am trying so hard to become an early bird.
It takes a little practice, right?
It does. Consistency, like with everything else.
Yep. How many patients, this isn't on here, but like generally speaking, like what's really heavy patient load that when you see patients in a day? Like what's the highest number of patients you've seen in a day?
One day, I know doctors who have seen 80.
Oh my gosh.
80 to 100. That is too many for me, but probably 20 to 30.
Okay. Yeah, that's a pretty good workload for a day. Well, yeah, we need a lot of bone broth for that.
Yes.
Okay. And then, here's a good one. What's your go-to stretch if you've been sitting in a car or a plane too long?
Lumbar extensions.
Okay.
So I would put my fists in my low back and go backwards.
Like
yes,
this?
exactly like that.
I like this one too.
That one's great as well, but specifically when we sit down, our pelvis comes out like this. The bones of our pelvis have
Okay.
to move outwards, and the ligament that attaches those bones stretches out. And so making sure that we put our pelvis back together is one of the best things that we can do for it.
Already. Okay, I love that. Oh, and you said you like reading. You love reading. So what's one book you've recommended to many of your patients?
This is rather pregnancy specific, but there's a book called Well-Adjusted Babies.
Okay.
That is wonderful for pregnant patients. It tells you a lot about nutrition and goes through a lot of the tests and a lot of things that will happen during your pregnancy and talks you through a lot of the details of that.
Yeah, I love that concept because I did get chiropractic care back when that happened to me and I was pregnant, and it did help a lot. So it was really good to learn a little bit more about chiropractic care in pregnancy. All right. Well, listen, thank you so much for being here and joining me in the podcast room. We're very excited to share your links below. And if this helped you, this conversation, please like, share, subscribe to my channel. Find me on YouTube, Apple Podcast, and Spotify. We are here to help inspire and create a beautiful life for each of you. And I'm going to continue to put out these amazing messages for your health and wellness. So thank you for watching if you made it this far, and we will see you in the next episode.